Good morning, good afternoon. I don't know the time zones where you are. My name is Nyara Zai Gumbonjanda. I am the African Union Goodwill Ambassador on Ending Child Marriage and the Chief Executive for Rosaria Memorial Trust. I'll be your moderator for this session, which is being hosted by WrapUp and by the African Union. Within the next hour, we are focusing on ending child marriage and stopping the spread of HIV in Africa. We know that these are topical issues for the continent. There is a critical effort to address this issue, which is affecting mostly adolescent girls and young women, but also young people, our families and our communities. We are live online, and you can tweet and you can send in your comments during the conversation. Today we have with us 3 panelists, and I'll go through with you on who they are, and then each one of them will make a presentation. If this is your first webinar, it's fine. We are good. WrapUp team is on standby to give us technical support as we move in this conversation, and just drop a line and ask a question. If you need technical support, they'll be there. Put on your headphones and your sound on, and just be listening, and all the attendees will be muted during this session. Please send in your comments. You can send in advance if there are issues you're thinking about. If there's something you've listened to and you want to ask a question, you want to send a comment, just drop in a message. You can either put it on the tools that are available to you, including also on the Twitter handles that have been shared with you. The panelists will then answer your questions after the 3 of them have presented, and I'm looking forward to an exciting conversation together. So welcome again, and thank you again to our co-hosts, WrapUp and the African Union. The Twitter handles are there. Make sure that you tweet along the way. To inform the conversation today, we have our first speaker, Dr. Kolombota, who is presenting research findings on a study on ending child marriage and stopping the spread of HIV, and really exploring the opportunities and challenges for action. We have to be action-oriented. So Dr. Kolombota, over to you. And after your presentation, we'll listen to Ruth.
Thank you very much, Nyara. And good afternoon and good morning, good evening to everyone. I'll present very briefly on a research study that I did on behalf of the African Union and WrapUp, really looking at how the nexus between child marriage and HIV, by particularly focusing on how these two can be linked, and looking at the opportunities and challenges that are there to really end the scourge of child marriage and HIV. There was an interesting study that was done in 2014, which analyzed the demographic health surveys in 96 countries. Again, this showed that with a 10% increase in child marriage, there's a 70% increase in maternal mortality rate. But the researchers could not find an apparent association with HIV, although they did say that in the context of high prevalence areas, which again I think we need to look at concentrated epidemics and generalized epidemics. In the context of high prevalence areas, girl-child marriage is a risk factor which warrants integration between HIV prevention and child marriage. So again, lots of food for thought from some of the literature that was coming up. And if we go to the next next slide, if we look at the biological factors, for instance, you can see almost an obvious link between how child marriage could possibly lead to HIV. Children have a very immature developing reproductive tract. It can easily get bruised. The mucosa membrane can be easily torn, and the protective cells are not yet fully developed. Thus, it could be easy for the virus to cross to cross and infect the child. Then intergenerational sex, again, that's a huge contributing factor to HIV. We know that with more intergenerational sex, you get higher incidences and higher prevalences of HIV. In Uganda, it was shown that if there's a 10-year gap between spouses, that the adjusted risk for HIV doubles. So again, it just shows how these two could be linked, and of course.
Move fast on the key findings, as we have two other presenters.
Okay. Yes. Thank you. I'll be done quickly. And we know that marriage is not protective of HIV prevention, and there's a lack of control in sexual decisions. Then there's the issue of concurrent partners and multiple partners. Again, that can be a key factor in linking HIV and child marriage. And then finally, poverty is a key factor in child marriage, and it's a key factor in HIV. So we can see these interlinkages that are there, and which warrant a lot more research. So I think for me, some of the key findings are the implications for research. We need far much more detailed research required to further elucidate this. How does child marriage affect transmission? What are the differences in generalized epidemics versus concentrated epidemics? Should we be able to merge social research in child marriage and HIV, and what are the policy implications? And I'll just quickly, because I'm running out of time, I'll just quickly go through some of the recommendations that were made following this study. I think one of the key things from this finding is that high-level advocacy really needs to continue. The African Union campaign to end child marriages has done a lot to increase awareness of child marriage, and this should really continue, together with synergy from UN partners, foundations, and donors. And we need to use data, to target the use of data a bit more, improve our surveillance techniques on how to identify child marriage, and how to harmonize collection tools between child marriage and HIV. And then finally, we need more research. We need more focused research on child marriage and HIV, including the wider dissemination of the findings, and more joint programming. I think it doesn't make a whole lot of sense to have very separate child marriage and HIV programs, and we should convene lead researchers in child marriage and HIV, which is, I think, part of what we're doing now, and learn the lessons that we've gathered from HIV programming over the past decades, and how this can be applied to ending child marriage. Child marriage programs can be a natural entry point for HIV prevention and treatment, and vice versa, and we should really exploit these opportunities that are there in order to end both scourges. I'll leave it at that, and I'm sorry for rushing through, but I'll look forward to further discussion. Thank you very much.
Thank you. Thank you so much for that presentation. I can see already some comments and questions coming in. Thank you, Kintu from Kenya. Noreen, you've sent in your comments. I think already we can see some of the critical conversation. I'm sure we'll come back to the issue of causality, much more based on your research findings and some of the issues that we are looking at. I would like to move to our next panelist, Ruth Koshal, with Girls Not Brides, the Senior Engagement Officer. You're sharing with us around child marriage and HIV from the perspective of CSO programs and advocacy. Ruth, over to you.
Thank you, Nyaritsai. Just to move on, just to start off, as mentioned by the previous speaker, each year 15 million girls are married before the age of 18, and specifically for sub-Saharan Africa, 39% of girls under the age of 18 are married. Unfortunately, if this trend does not continue, there'll be 1.2 billion girls will be married as children by 2050. The prevalence rates in the top countries, based on the percentage of women between 20 and 24 years old who first went union before the age of 18, quite a number of our African countries are in the top 10, including Niger, Central African Republic, Chad, and Mali. And if we also look at the absolute numbers, which is again of women between the age of 20 and 24 who were married before they were 18, Nigeria is in the top 10, as well as Ethiopia, Democratic Republic of Congo, and Tanzania. Now, what is the impact? And I think it's really important to look at the impact of child marriage, both as it relates to HIV and AIDS, but more broadly. And these are the health complications during pregnancy and childbirth, increase in risk of HIV, violence, schooling often ends with marriage, there's poverty, there are traps for girls and families in a vicious cycle, and inequality. And this is where I'd like to just mention how civil society has come together, and where Girls Not Brides, a global partnership to end child marriage, has brought together civil society so that we can work together on addressing child marriage, joint programming, joint advocacy. And currently we have over 750 members in over 90 countries across Africa, Asia, and Europe. And the civil society members, some are advocates, programmers, researchers, service providers, both from grassroots and international levels. And we have a multisectoral, diverse areas of expertise, including health, education, poverty alleviation, and human rights. And so why is it important for civil society to come together and working together at the national level? It's important to work collectively to address child marriage across different sectors, including the linkage with HIV and AIDS. And some of our members come together in terms of coalitions or networks and to collectively address child marriage. They're very diverse, and each civil society brings specific expertise, knowledge, experience to working together on addressing child marriage, such as advocacy and service provision for girls. So it's really important that as we look at the way civil society can work together, Girls Not Brides collectively, our members are doing this at the national, regional, international levels. But what would it take to actually end child marriage? And, you know, looking at the 4 major strategies, this includes empowering girls, mobilizing families and communities, providing services, and establishing and implementing laws and policies. Now, you know, why are child brides more vulnerable to HIV and AIDS? I think the previous presenter really talked about this, so I'm going to just move on to the next slide, mentioning that HIV disproportionately affects adolescent girls and young women, and we cannot end HIV epidemic among adolescent girls without ending child marriage. There are some examples of civil society programs, and some of these programs, what is really interesting is the linkage between the different sectors, not just HIV and AIDS, but also linking with schooling and the importance of education. One example is the Back to School campaign, which is the Mafara Initiative on Education, which is run by Camfed Malawi. And really it works to ensure that girls have access to quality and safe education. And they also work with local health center and education authority to identify any girls who have dropped out or at risk of becoming pregnant. Another example is Unite for Body Rights, which is a program in Tanzania implemented by the Sexual and Reproductive Health and Rights Alliance, which consists of AMREF in Tanzania, Restless Development, HAPA, Medicos del Monde, amongst other, but it really looks at training healthcare providers on youth-friendly service provision, create youth-friendly health centers, and advocating with the government for more healthcare resources and establish referral systems. And the final program I just want to highlight, I know there could be so many different programs and projects, and I'm sure those in the webinar could also share the ones they're working on, is an integrated family health program. It's funded by USAID and implemented by Pathfinder in Ethiopia. And what they really do is work to strengthen integrated family planning, maternal, newborn, and child health, HIV and AIDS, as well as reproductive health services at the community level. So it's kind of interesting to sort of look at what are some of the lessons for effective programs, both by civil society, but collaboration with government. One is to incorporate child marriage during program design by targeting family planning, maternal, newborn, and child health and HIV services to married adolescents. And then secondly is really looking at program implementation to include training healthcare workers to educate community members on the harms associated with child marriage and the unique needs of married adolescents. And then thirdly is to integrate child marriage into program monitoring, evaluation through measurement of child-related outcomes. And I think it's also important for us to also look at the need to address child marriage goals and objectives within HIV programming, but also to look at the monitoring and evaluation to understand the linkages. Married and unmarried girls alike should be recognized as a most at-risk population, just as much as we would look at injecting drug users, sex workers, prisoners, mobile migrant workers, and also efforts to target adolescent girls with HIV programs must also involve families and communities. And men and boys need to be engaged and empowered as positive agents of change in addressing harmful gender and societal norms, in promoting gender equality. And thirdly, in terms of the linkage between HIV programming with other multi-sectoral national initiatives, in a number of countries, there are national strategies or plans of action and campaigns to tackle child marriage, and this has been in collaboration with the AU campaign at the national level. For example, Tanzania has a plan of action to end violence against women and children. Ethiopia has a national strategy on FGM and child marriage. So does Uganda have a national strategy on child marriage and teen pregnancy. And the good thing about these national strategies, they look at a multisectoral approach, including health, education, employment, and justice, but HIV/AIDS needs to be incorporated. As well as other countries are exploring ways to integrate child marriage interventions into existing government policies. And it's also vital for comprehensive HIV programs to be linked with multisectoral initiatives, particularly those focusing on also sexual and reproductive health interventions for adolescent girls. And then finally, on my last slide, just looking at how can we work together and the need for us to collaborate and amplify our voices. At the global and the regional level, there's need for technical input, leverage funding, joint advocacy, research, designing tools to support stakeholders working at the national levels, for example, in capacity building and advocacy tools, and also working at the national level, the importance of working across the sectors, as I mentioned, ensuring everyone is on the same table to coordinate multi-sectoral efforts to address HIV and child marriage. So thank you so much, I do look forward to the discussion at the end of this webinar.
Thank you so much, Ruth, for that presentation. I always struggle with the word marriage when actually we are talking about a crime, a violence against women, rape, and illegality. I also feel in your presentation, and we'll already go to the next presenter, that these girls are single, are widowed, are in the same relationships, are in transit homes. So also understanding a little bit deeply into who are the girls we are speaking about. So thank you so much, Ruth, for that presentation. I'll go to my last presenter and 6-7 minutes, and then we immediately go into the questions. Pamela from Kenya, we've already seen your comment around media. Tulanuga, you possibly responded to around programs that are working, but let me proceed to Ramato, the Senior Regional Child Specialist at UNICEF. Can you share with us in your presentation around campaign perspective to ending child marriage and stopping the spread of HIV? What are the opportunities, the challenges, and the recommendations? Also recognizing some of the international commitments that we have, especially around the SDGs. Over to you, Ramato.
Thank you, Madam Moderator. Good morning, good afternoon, and good evening to everyone. Maybe before I start, I would like to thank the African Union and WrapUp for inviting UNICEF to speak in this webinar. So as you know, the UN and especially UNICEF has been a committed partner to the African Union, national governments, but also civil societies organizations in the campaign to end child marriage that was launched by the EU in 2014. So my intervention today will be focused on the programmatic aspects of child marriage and HIV. So in the next 5 or 6 minutes or so, I would like to talk about the imperative to address both child marriage and HIV and AIDS in Africa. I would also like to talk about what we know and also what we don't know about the linkages between HIV and AIDS and child marriage, and what does it mean for our programs, especially for programs that are implemented on the ground. Basically, what can we do? Then I would also like to share a few words about the UNFPA UNICEF Global Program to accelerate action to end child marriage. This program is being implemented in 12 countries in the world. 8 of those 12 countries are in sub-Saharan Africa. And then I will end with a few points on what we can consider as critical as we move forward based on what we've learned so far. So maybe if we start with the presentation, I think that my predecessors have already highlighted the devastating consequences of child marriage and HIV and AIDS in Africa, so I will not go back to that. But we know that both HIV and AIDS and child marriage actually are a danger to children's health, safety, education, and futures. So the evidence also tells us that both child marriage and HIV and AIDS affect disproportionately vulnerable young girls and adolescent girls. So there's a great dimension of discrimination there. And also because the evidence also tells us that actually adolescent girls engage more than boys in risk sexual behavior with less comprehensive knowledge of HIV. So this is what we know from the evidence. If we move to the next slide, and I think that as Dr. Kulambota really well explained, we can see that some of the root causes of both child marriage, if we look at the root causes of both child marriage and HIV and AIDS, we can also see that addressing these two issues simultaneously makes a lot of sense because there are a lot of common drivers, socioeconomic drivers, between HIV and AIDS and child marriage. And also there's a lot of factors that are actually aggravating factors that both child marriage and HIV and AIDS share. So it makes sense from what we see, even though we don't have the causality evidence and we're not sure about the causality linkages, we can see that the young, especially girls who are affected by child marriage are also tend to be most of the same category of those that are affected by HIV and AIDS. So on another slide, so what when we listen to Dr. Kolambota, he has highlighted earlier the various critical linkages between HIV and AIDS and child marriage. So what I would like to discuss now, very briefly, is what does it mean for our programming? So basically what it means from our programming, and again, going back to the different critical linkages that he highlighted earlier, what does it mean? If we look at the first one, and especially if we look at intergenerational sex, we can see that actually we need to engage more systematically in male engagement programs and initiatives. I know that this is something that on the ground is being done, and I'm sure a lot of the participants in the webinar today are working on that, but we may need to have a more systematic approach to it. And I also think that what we've seen is like we also need to have awareness raising initiatives that are actually more targeted, and using what we know from the research and from the evidence on intergenerational sex and immature reproductive tract of young girls. If we look at child marriage and the fact that actually young married girls have frequent unprotected sexual intercourse, we need to use HIV as an entry point to discuss sexual reproductive health in the context of child marriage. Again, we know that sexual reproductive health is a key pillar in addressing child marriage, and I think that we need to link it maybe more systematically to HIV and AIDS. And it can also be quite useful in some contexts where actually discussing sexual reproductive health is an issue. So if we look at the issue about on poverty, and the fact that actually marriage is not really a protective factor vis-a-vis HIV, I think that again most of the interventions to address child marriage actually focus on vulnerable girls, and I think that it is important for us to scale up those interventions and make sure that also that they are viable and sustainable, so that basically we can support girls who are in extreme vulnerability, and especially married girls and girls living with HIV. And then if we look at the issue of gender imbalances, gender empowerment, etc., we actually need to address social norms and those gender and power imbalances. This is normally a critical feature in any child marriage program, but also in HIV and AIDS programs. So I think that there's a lot of lessons to be learned here from the HIV and AIDS program for the child marriage ones. And then we also need, of course, to support women and girls' social and economic potential. This is critical if we want to see a difference, both in HIV and AIDS, but also in child marriage. And then if we look at the education and the fact that actually married girls are not having access or are not really looking for health care services, I think that it's very important that we actually have adequate prevention and care services, both for unmarried girls but also for married girls. And those services need to be adequate to them, because most of the time those sometimes services are there but they are not adequate to the needs of the adolescent, and this is something that is extremely important. We also need to ensure, if we've seen the role of education both in preventing HIV but also in child marriage, in the fact that education has been, there's evidence that education, especially in sub-Saharan Africa, actually can delay the age of marriage. So we need to support girls' access to school. We need to support the fact that girls stay in school, and that also that they have access to other forms of education once they are married. in the programs that we've been working with or we've been implementing with partners on the ground. I would like to quickly speak, as I said before, about the UNFPA and UNICEF joint
very quickly,
program.
because we're running out of time, yes. So you can really quickly move to that. So then if I can just go to then, what I would like to say is like, so this program has been implementing in 8 countries. What we've seen here is we've seen actually the effects of multisectoral programming and joint programming between child marriage and HIV and AIDS. We've said before that it doesn't make sense to run isolated or silos program. What the joint program has been doing is actually making sure that both the HIV and the child marriage, the protection, the education, the health, and the social protection are addressed together. So far, there's close to 1 million girls who have been reached last year alone, and more than 2 million people worldwide who have been also supported through dialogues, etc. So this is one of the good examples of where we've been trying to actually integrate both HIV and child marriage together. I will not then speak a lot on the challenges that we've seen so far, because I think that my predecessors have actually talked about that. But definitely we need more research on HIV transmission and harmful practices, whether it's child marriage or FGMC. We also seen that we need more joint advocacy and programs, because this is not really the case, even though we've seen that there are many common drivers. And again, as I said earlier, we need to make sure that the most vulnerable girls have access to quality services that are adapted to their situation. So maybe to conclude and to look at some of the recommendations, what we can say is, like, we need to improve in terms of programs. We need to improve the target and the reach to adolescent girls. We need to invest in advocacy, whether it's high level or community-based advocacy. We definitely need to scale up joint programs. We also need to strengthen social protection programs to address the poverty aspect. And we also need to continue to support evidence-based programming and research. Thank you. Thank you. Thank you so much. And such a deep presentation from you and the other 2 panelists. We have a basket full of questions, which I would like us to seek to cover in the time that we have. I think in all the presentations, I'm tempted to comment on a little bit on the content side as well. I'm really looking into also the issues of just the trauma, the psychosocial issues affecting both, and how that could also be addressed in terms of the interventions and the programs. But anyway, let's start with Nkitu Kenny, who came much earlier on the program and did several questions, but I just want to highlight 2 that Nkitu Kenny raises. The question she's raising, the question that Nkitu Kenny is raising is about young positive people, young people living with HIV, and how programming needs to target them, including involve and meaningfully for also child marriage prevention, but also if there are examples out there that we can draw on, because the research seems to have focused more on the link between child marriage and the spread of HIV, but also we need to look from the perspective of so many young people are living with HIV, and how are they also targeted and they're equally vulnerable to child marriage. So Dr. Kolombota, did you address that in the research?
Not particularly. I think how we addressed it, and I think it's a valid point. I think we definitely do need to look at young people who are living with HIV and how to address them. But we looked, the research that we did was mainly looking at how child marriage could be a catalyst to acquiring HIV, or HIV could lead to increased child marriage. So we didn't specifically look at this aspect, unfortunately.
I think then that points us to a possible research agenda and an advocacy agenda, and I'm looking at us having also ICASA coming up where we have also platforms to engage much more strongly with young people living with HIV to also be champions for the effort to end child marriage. There was a deep questions. I want to combine the question from Tulanoga and Nolene, which is asking to the panelists, and this I will ask both Ruth to respond. How are programs addressing the root causes when you are engaging with civil society? And are some of the programs that you've shared addressing the strategic issues, or they are still on the periphery of the causality, but not sufficiently the courage to address the root causes, including structural issues?
Yeah, thank you for the question. I just want to go back in terms of what it will take to end child marriage. And in the case of Girls Not Brides, we did put together a theory of change to sort of look at what are the, 4 key areas or 4 key strategies that it would take to end child marriage, but then of course trying to link this with addressing HIV/AIDS as well. And one is just the whole idea of empowering girls, and empowering girls also includes the whole issue of addressing gender inequality as some of the social norms and the root causes, empowering girls in terms of ensuring that their voice can be heard, ensuring that collectively they can work together in whichever way that makes sense, from the grassroots level to the national level, to influence hopefully what's happening at the national level. The second area is mobilizing families and communities, and I think when we talk about mobilizing families and communities, quite a number of Girls Not Brides members and member organizations have also been looking at the role of traditional and religious leaders in being change agents, in being champions, and also engaging men and boys, which I also mentioned, in addressing the whole issue of child marriage, but also the linkage with HIV and AIDS. But thirdly, provision of services. I think when we look at the root causes of child marriage, but also the consequences, both drivers and consequences, it's important to look at multisectoral approach and the role of governments and in provision of services, and this could be in the health sector, education, child protection, human rights, and democracy, and so many other areas. Because, for example, in addressing HIV and AIDS, you'd need to the whole issue of, do young people, including adolescent girls, have the opportunity to actually access services for testing, counseling, care, follow-up, and then fourthly, establishing and implementing laws and policies. Just saying, we've always said that a lot of our governments have very good laws and policies, whether it's on addressing child marriage, whether it's linkage with health and HIV and AIDS. However, they would also need to look at ensuring that all of our countries have set 18 as the minimum age for marriage, but that on its own will not be sufficient unless we also look at all the 4 strategies that I have mentioned together.
Mm-hmm. Let me quickly move on to here from the perspective of the UN. Still remaining within the legal conversation, Hune asks, Noreen asks, talk to us. What is the advice that the UN, through the joint program, UNFPA, UNICEF, and we know other UN agencies are quite engaged in the effort, in the campaign, like UN Women. How are you addressing the contradictions around the age of consent, the age of sexual consent, and the age of consent for marriage, and the age of consent for access to sexual and reproductive health services and commodities? So if you can just quickly comment around the contradictions within policies and laws, because we see at times different legal ages for those critical aspects, and not just the age of marriage itself.
Yeah, thank you. So as you said, in a lot of our countries, actually in a lot of our African countries, we have different age of consent. And what we're trying to do is to look at, and we're trying to work with governments and civil society partners, is actually trying to look at the issues of adolescent and child marriage as a multisectoral issue, but also as a holistic issue. Basically what we're trying to do is trying to reform those legal systems to make sure that the different pieces of laws are harmonized, because what we've seen so far is many countries have actually or adopt a law based on a thematic issues. Maybe it's about sexual and reproductive health, or maybe it's about marriage, etc. What we're trying to make sure is look first at the international standards and making sure that basically what the countries have adhered to, and the international and the regional conventions that the countries have adhered to, they're trying to make sure that this is domesticated in their national laws, but looking and from an holistic point of view, as opposed to looking at different set of laws. And I think that this is the way where basically we can see those contradictions, and we can actually work together with the governments, but also with the civil society partners, to try to look at how we can actually reduce or in most time harmonize this, to make sure that the laws are actually developed and enacted in the best interest of children.
There's a great question. Thank you for that. There's a great question also from Pamela. I know she's a media expert, and she asks, how is the media, what is the role of the media? How is it that integrated into the campaign to end child marriage and the efforts by the different partners? So I want you to think about that question, and then when you do your last round of comments, I would like you to really respond to Pamela. There's a shout out and a kudos from Plan International, the Pan-African office, from Chris. We're saying this is great. Great presentations from the three panelists, and we need more of these conversations. Thanks so much, Chris, for that feedback on my panelists. And we have Onias Flungwani, who is also asking about evaluation of the UNFPA UNICEF program. So Ramato, when we come to the conclusions, to the summary, can you also give us a word around the issue of evaluation, because that is critical within itself. The other question that we have from Chantal from Burkina Faso. Thanks so much, Chantal. My French is not good. Your English is excellent, so I'm guilty. How the question from Chantal is, and that would go to Ruth, is around civil society organizations like bloggers. How are they involved in the campaign? And from Dr. Kwalombota, the other question that is rolling strong and clear is the extent to which young people cannot negotiate safer sex. Is that not also an issue related to causality? We have more questions that are coming in. I'm conscious of the time that we have, Harriet. The same questions around sexual and reproductive health and rights that Harriet is raising. So I want to come back to our panelists for you to do your round on the conclusions. I can see that our time is really running out and we need to be winding up. So let me start with the last, Ramato.
Okay, thank you. Thank you so much. So maybe as a wrap up, and I'll try to address very briefly also some of the questions. What we like to say and what I would like to end up with is, again, to highlight that with their social, cultural, and economic ramifications, both child marriage and HIV must be seen as a major obstacle to sustainable development in Africa and to a fairer future for all children. This is how we see it, and that's why for us this is important. We also know that we can actually stop the spread of HIV, and we know that if we address the underlying causes of child marriage, then the practice will end. So we believe that it's important to strengthen education, health, including psychosocial services, justice and protection systems in countries where child marriage is heavily practiced and HIV is endemic. We also believe that the role of the media is critical, and we've been engaged also with the African Union with the media in capacity building workshops, etc., because the media has this power. Actually, if we want to transform social norms, I think that the media is critical also to share the knowledge. In terms of the global program, all what I've said before, we actually believe that to address both child marriage and HIV and AIDS, this can only be done through multisectoral approaches. We need to joint efforts and through partnerships. The global program, as I said, has been implementing in 8 countries that started 2.5 years ago. Right now, there is a major evaluation that will take place worldwide to evaluate most of the interventions, because again, the global programs are just built on what has been done for years by NGOs, etc., etc. But we need to make sure, and this is something that we're not very good at least in child protection, and also in child marriage, to make sure that actually we can evaluate, we need to evaluate the impact. So I'll be happy to share further details with the participants, but right now we are in the evaluability assessment phase, where basically we're looking at the possibility to evaluate the current programs, and then there will be a major evaluation in 2019, and we hope that based on this evaluation, the global program will be extended into more countries in the world, and especially in Africa. Thank you.
Thank you. Thank you so much. As you do the evaluation, there's been a strong call out in the webinar in this session for greater involvement of the young people themselves. So we hope the evaluation will reach out to the girls at risk of child marriage, at risk of HIV, to the girls who have experienced and the children who have experienced child marriage, and those who are living with HIV. There's a very intentional investment in the evaluation as well as the engagement with civil society. So thank you so much for giving us that information. Let me ask our researcher to ground us a little bit more in listening to the comments, questions that have been raised. You're closing with Dr. Kwalambota, and with a question that has just come in on where is the funding for research? Do we have resourcing for research? Dr. Kwalambota.
Great, thank you very much. It's been a very enlightening webinar, and it's good to see that there's a lot of momentum that is being built. And I think for me, a researcher, as a health professional, as a public health professional, even though we might say that we don't have enough evidence or causality, I think we do have enough evidence to start making actions and to exploit those opportunities. I would just like to say that in terms of research, we really do need to find funding for research, and whether that's going to be done through the African Union or through other partners, through the UN or through foundations, we definitely do need to find operational action-based research. I liked what WrapUp did by translating the bits of evidence into concrete entry points into programming, and I think that's what we need more of. And I think the use of the media is really key. I think talking amongst ourselves as researchers, as health professionals, will only get us so far. But it's how we exploit the media, how we take the message out, how we use social media, how we use Facebook, how we use WhatsApp, Twitter. That's the only way that these research findings can actually make a difference. And so I'm a very keen believer in really packaging evidence and research and making it accessible to the public, and that can only come out through the use of media, through the use of social media in particular. And then just finally, a very quick one is that we definitely do need to involve young people both in research and identification of research questions and in the conduct of research. But I think there's enough momentum that is being built, and I think we should not lose this momentum. Thank you very much.
Thank you. Also, this has been fantastic. I love us to continue to be grounded on evidence. I'm we would also like to continue to reach out to you as health professionals on what exactly do we mean by causality. Because I'm still struggling on whether that causality is a direct or we are actually talking about baskets of factors that creates risk. And so I'm still wanting to know the definition of causality and to see whether really we do not have sufficient linkages looking into the social and economic and cultural factors. Yeah, that's a research question. That's a question out there. And thank you so much. We definitely need to continue to invest in research as part of both the Twin campaign, the campaign to end child marriage and support girls who have experienced this abuse, and also our continued effort on the continent to end HIV and to support the rights of people living with HIV, and especially young women and girls. Ruth, talk to us, your last words.
Thank you again, Nyaritsa. Just to finalize, just to reiterate that it is vital that comprehensive HIV programs are linked to a multisectoral initiatives, which is both what Kwalambota and Ramatu have also mentioned, and particularly those focused on sexual and reproductive health interventions for adolescent girls. And it's also important to look at the commitments that governments have made at the national, regional, and global levels, and to keep them accountable to these commitments, and also to engage youth and girls in most of our interventions. Looking at the AU campaign, there was training for media, and this is to respond to one of the questions. The training was for Eastern Africa, Western Africa, and Southern Africa. I think this was another opportunity for media to understand some of the technical areas around child marriage, commitments made by at the regional level, including on the African Charter, and also the role that the media has in amplifying the voices of girls, amplifying the voices of families and communities at the grassroots level, both nationally and globally. And also just to mention that there's a question from Burkina Faso about the role of bloggers, but in the case of Girls Not Brides, we do have actually blogs that we put up on our website, and I would welcome the participants of this webinar to also look at our website to get critical information, country-specific, global, new trends, some of the thinking around child marriage and what is happening. So basically, Girls Not Brides is really keen to continue partnering with UN agencies, with the AU campaign, our members, our national partnerships, to ensure that the voice of civil society and especially the girls and youth is heard as we address child marriage and HIV and AIDS. Thank you.
Thank you. Thank you so much, Ruth, and thank you to all the panelists. The African Union and WrapUp are passionately pushing this agenda. We know that this year the African Union Commission would be presenting its 2-year report to the African heads of states. We have the African Union common position on ending child marriage. We have a plan of action for implementing the effort. The African Union has established a CSO reference group to support the efforts on the continent, and we really want to appreciate WrapUp and Naomi, who is our co-facilitator for this session, who is a member of the CSO reference group. We know many countries have launched the national campaign to end child marriage, and as we always say in the campaign, a launch is not sufficient unless if it is accompanied by adequate policy, adequate implementation, services, change of behaviors, and strong collaborations and partnerships at the country level and within our communities. So I want to thank my colleagues at the African Union campaigns team, Kenneth, Nena, Sophia, and the rest of the team there. I also want to thank my colleagues at WrapUp, all who have, Angelita, and all who have worked so hard in putting this together. Lastly, I asked a question to our hosts today, WrapUp and the African Union. Is this a one-off? No. We are looking at continuing these webinars as a space and a platform for sharing information. And we still have online almost 50 persons from across the continent who have been so much involved, so much engaged in this conversation for the last 1 hour, sending questions, sending comments, sharing experiences, tweeting. I want to thank you all so much. Every action counts. Every action does count in ending child marriage, in supporting girls and young boys, some who have experienced child marriage, but also every action counts as we strive to end HIV and as we strive to live in a world where all human rights are protected for all our children. So I thank you so much. It has been a pleasure to be your moderator for this webinar. Thank you.